When you schedule a doctor's appointment, you might be wondering, is this going to be covered by Medicare? Today, I'm going to go over the two types of services Medicare covers so you can see if your appointment falls into either one of these categories. And it's really important to know before you schedule the appointment whether it's going to be covered by Medicare. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today we're going to talk about something very important. What does Medicare cover? Because when you enroll into Medicare and you start scheduling doctor's appointments, specialist visits, outpatient surgeries, it's really important to know, is Medicare going to cover this, or am I going to end up with some giant bill after I've been denied services? So before we even start scheduling these appointments, it's really important to know, does this fall into a category of services that Medicare covers? And really, there's two categories, two big ones, and I'm going to go over both of those, and that's the best way to see, will Medicare cover my service? Before we get started, if you find the information in this video helpful, I'd appreciate it if you would give it a thumbs up and subscribe and leave a comment down below. And now we can dive right in. So like I said, there are two categories of services that Medicare will approve. And the first one is medically necessary service. So if a service is medically necessary, aka you need it, medically it's very important, your doctor says this is absolutely important, something we need to do, Medicare will approve it. So from the Medicare.gov website, the exact definition states, services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. So what that means is if you absolutely need this service, it is approved by Medicare. Your doctor notes that you need this, it's approved. So this is not things like, ooh, I want this, maybe it would make my life a little bit easier, something that's not necessarily medically necessary. So things like cosmetic procedures, yeah, they're great, but they're not medically necessary. They're not approved by Medicare. And what's really important to know is that if Medicare approves it, so does your Medicare supplement plan. And that's what I do. I assist people in finding the best Medicare supplement plans. Give me a call. My number is 833-65-JAMIE. I can work with you to find the best Medicare supplement plan. So you're not really looking at much out of pocket at all after everything is said and done. Because as long as Medicare approves it, so does your Medicare supplement plan. So if your service is medically necessary, you're good to go. But what if it's not? What if you have some other questions? That's where the other category comes into play, and that's going to be preventative services. So again, from the Medicare.gov website, preventative services are defined as healthcare to prevent illness or detect it at an early stage when treatment is most likely to work out. So what that means is those are things like the flu shot and testing, mammograms, things like that, that help you prevent an illness from going further. So kind of catching it at the beginning to limit any kind of sickness or illness. So if your service is preventative, like I said, biggest one people think of is getting their annual flu shot, it's covered by Medicare. So in reality, like I said, we've got two big categories, medically necessary services and preventative services. If your doctor, specialist, lab, anything falls into those, it's covered under Medicare. If not, you need to make sure it does fall into those categories after speaking with providers, because if not, you're going to end up with some possible denials and paying for it completely out of pocket. So like I said, if it's not in one of those two categories, what's not covered by Medicare? What are some things that I'm going to have to pay for on my own, or maybe even have a separate standalone plan? The first one is dental care. So cleanings, fillings, implants, all that, not covered under original Medicare. Same thing goes for eye examinations. And this is strictly eye exams, glasses, contacts, things with an optometrist, things covered under an ophthalmologist like cataracts, glaucoma, those are medically necessary and those are covered. So when we talk about eye not being covered, strictly things like exams, glasses, contacts, anything more medically necessary with an ophthalmologist would be covered under Medicare. We also have hearing aids. So if you have some hearing impairment, and this is the exam, the fit, the aids, those are not covered by original Medicare. Something probably pretty apparent is cosmetic surgery is not covered by original Medicare. So if you want, Botox, a facelift, things like that, that are just to kind of enhance your appearance, it's not going to be covered by Medicare. Things like dental, eye, and hearing, generally you can get a separate standalone plan at a pretty low cost to cover those. They just, again, are not covered under original Medicare. Some other things not covered are going to be massage therapy, acupuncture, routine foot care, and long-term care. So generally, when Medicare lists the things they do not cover, these are the main big categories that people have questions on. But the good way to think of it is when you're scheduling your service, you have to think, is this medically necessary? Do I need this for, my quality of life to survive? Would I be at a detriment if I did not have it? Or is it going to help me prevent further future illness? If it does not fall into one of those categories, it very well may not be covered by Medicare. If you have any questions about this, you can always call me. What I do is I assist people in finding the best Medicare supplement plan, because although a lot of these services are covered under Medicare Part A and Part B, they're not covered fully. You've still got responsibility in terms of the 20% not covered by Part B, as well as your Part A deductible. And that's what I do. I assist people in finding the best Medicare supplement to pick up that coverage that's not covered by Medicare. You can always call me. My number is 833-65-JAMIE. You can visit my website, medicarebyjamie.com, or you can email me, jamie@medicarebyjamie.com. I can walk you through exactly how it is. There's no cost to you, and I'll answer any question you have related to Medicare. Hope you found the information in this video helpful. If you stay tuned, I'll give you a tour of my website, show you exactly how to request that free Medicare supplement quote. And if you found it helpful, please give this a thumbs up and subscribe and leave a comment down below. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.